Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I'm back in the studio more often than most this season, so that's been wonderful. I love doing our podcast. Thank you so much for those that continue to tune in and listen to the many random topics that we come up with that we think you would be interested in. But shout out to Cello, who continues to lead this podcast for me, who literally, I was just telling our guest speaker today, Dr. Santos, that I literally just come in, guys, and she has everything set up, and I'm so spoiled to host this podcast because my team just thinks about all of the details for me. So if it looks like I'm doing all of the work, I'm not. But today, specifically, we have Dr. Theresa Santos in the house. And I was just, we're just catching up before I hit the record button about our kids and our lives and just where we're at. And I knew Theresa before she was even married.
Yeah.
We knew each other before you were even married. She was here before the 3W even opened. So that's how long we've known each other, like 13 plus years, I think.
Yeah.
That's crazy.
I feel like you invited me to a random, like WHAMS was coming into fruition meeting kind of thing. Or just, I think you should come. And
yes.
I was like, okay.
But that's how long. And now you're a mom of 3, which is insane.
Yeah.
And you're a doctor, which is another insane thing. Has that hit you yet?
No, it hasn't. It hasn't.
I'm just, I don't think proud is the correct word to really encompass just the journey that you've been on. And just, it's very full circle. It's very surreal. It's just, gosh, we're old.
Yeah. Oh, yeah.
We're old and we're just like, we're moms and like we're in these seasons in our careers. But gosh, Theresa, it's just been so crazy to just follow your life and just see where you're at. And we're just so happy for you. We're just so happy for you. And the cool part is, guys, is that she has joined our team as a per diem physician that sees patients right now on Saturdays, because that's the best time for her to see 3W patients. And we're just so grateful. Thank you, Theresa, for sharing your gifts with our patients.
Yeah, of course. Crazy full circle moment. I feel like, ever since that meeting of WHAMS many years ago, and I think I saw Steve at some random, like on campus, there was like a meeting. I don't even know.
Yeah.
But I think that's where I met Steve too.
Yeah.
And I think 15 years ago or whatever, it was like you knew that I wanted to do something in healthcare, maybe medicine, whatever. And you're just like, just tag along.
Yeah.
Kind of thing. And I was like, let's do it. And then as the journey kept going on and I could see myself in medicine, and it's like, well, what do I want to do in medicine? What kind of physician do I want to be? It's like the way that you were talking about 3W, and then it like started to come into fruition. It's that's exactly what I want to do, actually. And so it's funny that it happened in parallel, and then now like the timing is that we can finally cross paths officially.
Yes. Yeah, I've always wanted Dr. Santos to like work for us, and so it's of great honor that she said yes and that she's a part of our team and a part of our mission here in Seattle. And it is such a full circle moment, and just life works out really beautifully. And It's taken you so long to get here. And I don't, if I were you, I would have given up so long. And you are so persistent. And shout out to like your spouse, your husband, Brian, for holding down the fort. And I don't know how you did this. I don't know how you did med school on top of being a wife and a mother. Like that blows my mind.
Yeah. So
do you look back and it's just, I don't know either.
Yeah, no, exactly. And I think it's like the moment just happened, you know, and then you just don't know the difference.
Yeah.
Kind of thing. And I think when all this started, like before going into medicine, like I knew I wanted to have a family. I wasn't with anyone though. So how's that going to happen?
Yeah.
But I just knew down the line at some point, if it were to happen, that's what I would want. And then same thing with being a physician. It's like, I knew that's what I wanted to do. Could I get into med school? Could I go through med school?
Yeah.
And then like the two combined, it just like, how is that going to work? If I go to med school and I get married and I have kids, who's going to watch the kids? You know, like I heard pretty much horror stories. Like I remember in high school, there was a career day and the physician that came in was like, don't do it. Like it is a horrible life. Don't do it. Like don't have kids. Just don't. And then I was like, yeah, that sounds terrible. Why would I ever do that? But like it's still, the idea still kept creeping in of like being a doctor, being a wife and a mom. I was like, I'm just gonna
roll the dice and do it.
I'm just gonna.
And you did it.
Yeah.
That's the thing, is that you've done it beautifully and successfully. And at least from the outside of us watching, you've just done a beautiful job and your children are gorgeous. And I was just telling Theresa, I'm just asking her, I was like, are you going to have more kids? Because I need to see more of them. And it's just such a testament to you honoring your vocation as mother and wife, but also this huge calling on your life to share your gifts to other women that you get to serve. And there are women out there that are like, I can't do that. I can't have a career. I can't have kids. I can't have all these things. And you can. There's just certain sacrifices that you have to make in the season that you're in.
Yeah.
And it's not going to be perfect and it's going to be very messy, but Dr. Santos can do it.
Yes, if I can do it, truly anyone can.
So, I mean, not to like minimize it in any way, because of course you're very gifted, but there are ways that your community can pull through for you, and you don't have to do this alone, and you can come out of it the other way. And I'm sure it's been bumpy along the way, right?
For sure.
I'm sure there are moments where you're like, what the heck am I doing?
Yeah, many.
When you're like pregnant, right? And still having to go to school.
With my first, with Aiden, my eldest, I was a third-year medical student, and I was on my internal medicine rotation, so pretty much in the hospital, working like a physician, but you're just a student. Yeah. But still, you're working the same hours. So I was on a call shift, which is basically 24-hour shifts every 3 days. And when we say 24, it's really like 30 hours. And I was 8 months pregnant at the time when I was doing that. And I just remember like early Monday morning, it was like 4 a.m. or something, my water broke. And then I called like the people on my team and I was like, I can't come in today kind of thing.
Yeah.
My water just broke. But leading up to that, like when we were going through the hospital and like visiting our patients and I was like waddling through, I was like, I really hope that like my water doesn't break here in this moment. I hope I don't go through labor as we're walking through. Like that's like just not the way that I want to do it.
Yes,
like,
of course. Yeah.
Yeah. Personally and professionally, like as the med student, you're like already at the bottom of the totem pole and you just don't want to be known for that. Like I didn't mind being pregnant. Like I actually thought that was awesome. And I do think like the people on my team that were like higher up on the totem pole and in the hierarchy were like surprised, but also like that's awesome. Like I never felt judged in a negative way necessarily.
Oh, that's wonderful.
So I'm grateful for that. But at the same time, I did not want to be at work having a baby.
Oh, yeah. Oh, yeah. I'm sure you would have been like, can I hit the pause button so I can do this and then come back and be pregnant?
Yeah.
But that's just not how that works. So your journey through med school is just wild to me, but being pregnant 3 times. But aside from that, I know that we talked about you being exposed to a lot of different specialties. And at one time, I remember you wanted to work like in psychology, like with like
psychiatry.
Yeah. And with that, and then where did you land eventually?
So that's a great question. Let's see. I think going into med school, I thought pediatrics. I think that's a pretty obvious one. Like if you love kids, like they're super cute.
Yes.
And so that seemed pretty straightforward for me. That's what I wanted to go into when I went into med school. But then pretty early on, I realized I like talking to adults too. Like it's actually not that scary or bad kind of thing. And then so I broadened my interests. And then, with medical school, you go through different rotations of different specialties. And then that's how you get a sense of what do you want to go to? What do you want to practice in the future? And out of the rotations, I really surprisingly loved psychiatry. I think for a lot of people, psychiatry tends to be off the table at the very beginning of school. I think traditionally psychiatry, you don't think of it as medicine necessarily because a lot of it does involve talking. Historically, there hasn't been a lot of evidence or data in terms of how to do treatments and how to diagnose. That's definitely gotten better through time. But I think just historically, psychiatry has been an unpopular field of medicine that people choose to go into.
Okay.
But so I think for me, I didn't have a lot of expectations for it. But when I went into it, so a lot of my rotation as a med student was at the hospital. I did my psychiatry rotation over at Harborview Medical Center.
Oh, Harborview.
Yeah. If you're in the Seattle area and you say Harborview, like you just know.
Yeah, it's a catch-all.
Yeah, it is a catch-all. And the psych ward there, if you want to do psych, that's where you go for psych kind of thing. Yeah. And I think just when, in general, it's attached to a big academic center. So you do see a lot of like rare medical cases, very serious, trauma 1 level center, things like that. Yeah. And so in the same way, that's how you think about like the psychiatry cases. And so that's what I saw over there. And I just was mind blown of the cases of the people that I saw there. So the first half of medical school, the first 2 years, you're just in a lecture hall, very traditional learning in that sense of someone lectures, you read textbooks, you study that kind of material. And then the last 2 years of med school, it's all in person. Hands-on learning. You're meeting patients. You're working with the doctors. Yeah. Things like that. And so I remember like the first 2 years when I was in like the more psychiatry textbook block of school, it was like, okay, these are the different diagnoses that are out there, right? There's anxiety, depression, there's bipolar disorder, there's, schizophrenia. Yeah, like you name it. But it's all like very distinct. And that seemed very straightforward. But then in real life, in the patients that I met, it was like, no, there is not like, there's no like, oh yeah, you only have anxiety. You only have ADHD. You only have bipolar 1 disorder. No, you could have bipolar 1 disorder and schizophrenia. Yeah. And it just felt like such a puzzle piece to be able to figure that out, but also accepting that like, you don't have to have an exact diagnosis. Like you don't have to be right away kind of thing. And I thought that was like the most exciting and beautiful thing about psychiatry is like we just spent the morning talking to patients. And it wasn't about tell me your symptoms kind of thing that you would for like a patient coming in with chest pain, right? That's very systematic of
going down a checklist.
Yeah. Of qualify what you're feeling. Like what is your chest pain like? Whatever. Yeah. But with the psych patients, it's like, how's your day been?
Yeah.
Did you sleep okay? Kind of thing. And then you just let their thoughts come into fruition.
Yeah.
And then you just follow along. And then, like, based on that conversation, it's, from their thought process, like their pace of speech, it's, I think they're showing signs of this disease process. And then the next day, because it's like inpatient unit, so you're following these patients over,
a period of time,
several days, even weeks for some of these patients. And then it's a week later, you're with that same patient. And then all of a sudden, like their thought process, the things that they're talking about, you're like, and then you could just have this feeling of, I think it's this.
Yeah.
But then is it this, not this? Or is it this on top of this kind of thing?
It's like people are complex. Yeah.
Yeah.
And you can't just diagnose them and put a label on them and put them in a box and say this is, because they might have psychosis this time and then not this other time. Or like this other thing, or that is masking something else.
Exactly.
Or, yeah.
And what I thought was like just mind-blowing was that, like, it's all encompassing one system in the sense of, like, psychiatry, neurology, it's focusing on the brain.
Yeah.
Like, you could have all of these things with just one organ system versus, like, I don't know if I'm explaining this correctly, but, like, you have your heart and you have all these diagnoses that, like, involve the heart. So you could have a heart attack, heart failure. And then a person could have pneumonia or asthma or COPD, like a totally separate system and those diagnoses. And so that makes sense to me that, like, someone with pneumonia can also have heart failure. That makes sense because they're two different systems.
Things.
But then it's like you could have 10 different diagnoses with just the brain. Like, that's mind-boggling. Like, whoa. Yeah. And then it's you don't have an EKG. You can't listen with your stethoscope kind of thing to diagnose, like, mental health disorders. Just have the conversation. So to me, that just felt, a lot more gray zone in that sense. And I think for a lot of physicians, that scares us.
Oh, yeah.
Because we are there to have the answers and to fix people.
Right.
And it's not as straightforward in psychiatry.
Yeah. Yeah, it's very gray, and it's not this instant return of investment kind of situation, right? So it manifests over time, or you have to be, I'm assuming that you got to do it a lot or talk to a lot of people to then pick up certain patterns too.
Yeah.
And these are the kinds of conversations that I'm always just like, really good choice not being a doctor.
Yeah.
I am totally not gifted in that area. But it sounded, when we spoke a few years ago, that was kind of where you wanted to land.
Yes.
But eventually that's not where you landed.
No.
Right? So you came out of that interest and then now you're in primary care.
Yes. Yeah.
Yeah.
I am now a board certified family medicine physician instead.
Yes. So how did you go from being very passionate about the brain into much more of a broad spectrum, kind of broad brush of healthcare now?
Yeah. So towards the end of medical school, then you prepare yourself for residency. And residency is basically where you choose to specialize in your field of medicine. And in order to do that, you go through this whole application process and you have to say, this is why I'm interested in this field. These are all the things that I've done to get to this point. And when it came to my time doing that, I knew I loved psychiatry and I knew I loved that rotation, just like we talked about.
Yeah.
But a part of me also loved my family medicine rotation. And family medicine, for those of you that don't know, family medicine physicians are like the jack of all trades.
Yeah.
We are trained to do anything and everything.
Yeah.
So we see pregnant women, we see babies, and then all the way up through geriatrics and end-of-life care. So pretty much all across womb to tomb kind of thing.
Yeah.
And especially when you're in rural medicine or in rural areas of the country where there is a shortage of physicians and healthcare professionals, the family medicine physician is truly the one that does it all.
Yeah.
There are some family medicine physicians who are even trained to do certain surgeries.
Sure. I could see that.
And yeah, I think family medicine physicians are just amazing in terms of the scope that they're able to practice. And so that's part of what really drew me into family medicine more so than psychiatry. I think those that go in either field have a very similar heart of just really enjoying the time to sit with patients and getting to know them on a personal level and in a more intimate way than you would in any other field of medicine. And honestly, probably unique to any other career. And I think physicians are privy to a lot of information that we may not even share with our closest friends or family kind of thing. Like that's how intimate things can get between a physician and a patient once you've really established that relationship. And that doesn't happen overnight. But during my family medicine rotations, I did have that benefit of seeing physicians who had patients for 50 years kind of thing. And it's like they didn't just have that one patient, they had the spouse and then they had the kids and then they had the grandkids kind of thing. And then they were delivering babies of the grandkids.
Yeah.
So it's like this whole multi-generational relationship that physicians got to experience. And so that ultimately is what drew me to family medicine.
Yes.
And I think my personality wise in general, like I'm the type of person that I don't think I could just do one thing for the rest of my life. And I feel like family medicine offers that variety of if you get bored in one thing, you can always move on to something else and find whatever interests you. And that's not to say that family medicine physicians stay broad all the time. There are those docs that literally do everything and can do everything, but others where it's like, they like through their paths of practicing, they found something that they really enjoy and they're able to hone in on those skills the more that they practice. And so like I know I have a friend who's a family medicine physician who also works at a dermatology office because she loves skin, she loves procedures. And even with practicing general family medicine, she does some extra time at a dermatology office.
Wow.
Yeah.
That's really interesting. Yeah. So that's just as there's been such a lack of primary physicians. It's just not in our state, but across the country. And so it's such a gift that you went into this specialty in itself because you're going to be able to see a variety of people that are lacking that resource. I'm sure you've heard primary care is just bottom of the totem pole right now. There's just not enough of you guys to go around. COVID really did a number on—
Definitely a burnout there.
Yeah, just on medicine in general. But there was a big exodus of, I feel like, a lot of primary care physicians that were either burnt out or just kind of fed up or just, you know what, I don't want to do this anymore. Because I'm sure they weren't treated very well during that period of time. But also there was just so much involved in COVID that probably people are just like, you know what, it's time for me to retire and I don't want to keep doing this. So it's a huge blessing to our community to have folks like you come into primary care because it is, like you said, it's so hard to find good primary care clinicians, but also who do you trust these days with your healthcare? And like I said, it's been wonderful. Our 3W board and us have just been waiting for Dr. Santos to finish things up. And when we were able to bring her on, that was like moving our organization into another level of bringing on a physician that's part of primary care. As we continue to broaden our scope of practice, bringing you on is a game changer for us. For primary care, as you said, it's a wide spectrum. It's a wide scope of practice. For people out there who are looking for a primary care provider, as hard as it is, there are still people out there that does this. What are some top 3 things that you could share with our listeners on where they could find a good primary care provider out here in Seattle, but also what should they be looking for in a primary care clinician?
Yeah. That's a really great question. And I think, like you mentioned, there has been a big exodus of primary care physicians in general, I think across all specialties. I think you're right. Like COVID did a big number on the healthcare system, and just the need is so great. Before, when I was a med student, I feel like when looking for a specialist, it took months to get in.
Yeah.
Now, sometimes it takes years to get in. And then for primary care, the wait list can be months as well.
Yeah.
Before, it'd be pretty easy to establish. And now it's like sometimes you got to wait months to get into a clinic, which is insane for primary care.
Yeah.
So I think regardless of the specialty, I think there's a shortage everywhere, unfortunately. And then as for like the top 3 things to look for, I don't know that I have 3 specific in mind, but I think what makes it hard is that it really just comes down to the individual, and it's subjective in a sense of like the patient. You have to know yourself first, I think, in a way, to know what your preferences are for a physician or a healthcare professional. But I think one of the big things is knowing that there are 3 broad categories when it comes to medical decision making, right? First off is paternalism. And so let's say maybe 100 years ago or so, like the doctors were the ones that knew everything. You came to them with your symptoms, they diagnosed you, and they treated you. They're like, you have this, take this. And the patient just said, okay, I trust you. I'll do what you say. And so that was the way that medicine functioned for a long time, probably a majority of history, I would say.
Sure.
And then later on, in more recent history, it swung to the opposite end of the spectrum, where it really prioritized patient choice. And it was like, regardless of what the doctor thinks, what the doctor says, what the doctor knows, it's all up to the patient, and the patient knows best. And so that really prioritized patient autonomy. But that was on the other side of the spectrum. And so that could be like without the patient really knowing what the true risks and benefits or alternatives of a treatment was. It's like their opinion, whatever the opinion was, that's what they wanted kind of thing, and that's what they went through. But then now I think what's been more popular is a middle ground of the 2 practices with shared decision making, where a doctor comes in and says, these are the symptoms that you're telling me. This is what I think the diagnosis is. This is the treatment plan, and these are the treatment options, I should say.
Yeah, or recommendations.
And recommendations, yeah. And all of the encompassing risks, benefits, alternatives that go with each possible option. And then the patient will say, great, these are the things that I value, say quality of life or whatever. And they'll offer that. And through those things, you come to a shared decision of that, again, that middle ground.
Yeah.
These are the options, and this is the one that best fits what you value for yourself as a patient.
So there's more of a collaborative approach to the healthcare you're receiving.
Yeah. And so based on those 3 different models, I think I would pose that to a person that was looking for a physician, whether it's in primary care or a specialist, of where on that spectrum does that physician lie, and where do you want that kind of relationship to be in? And I think that's why I say it's hard to answer. And that's why I say it's very subjective, because I've had patients where I'm trying to do shared decision making, and at the end of it, they're like, I don't know, you're the doctor. I'm like, okay, so I guess we're going paternalistic kind of thing. Yeah. And then others where I try to do shared decision making, and they're like, yeah, I just want to do this.
Yeah.
They already had a treatment in mind, and that's what they came for, kind of thing.
Right.
And so it's up to you, and knowing yourself in that way.
Yeah.
And ultimately, like, who you feel comfortable with. Can you have a conversation with the person that's in front of you? Can you share intimate details about yourself so that the physician knows all that is pertinent and relevant to make a full kind of diagnosis and treatment plan that is right and unique for you?
Yeah.
So I think that's ultimately what's important.
Yeah. Thank you for that. Would you encourage patients to shop around? Yeah. And not just take the first available, because that's the constraint, is there's not enough of you to go around.
I know.
But then there's also, you have to balance it with, you also can't just be okay with someone that you're not jiving with, right?
Yeah.
Like you are coming into a pretty intimate relationship with someone in a lot of ways. Yes, it's a professional one, but they know everything about you. So you kind of do want to be picky, and I think you have the right to be picky. And like you said, you're sharing with this clinician things that you don't even share with your spouse sometimes. I think you should, but sometimes it takes a little bit of time to figure things out with your clinician, to go home and be like, so this is what we're landing on, and what do you guys think? Or whatnot. But you are coming to a space where things like values and opinions and maybe even ethical decisions are being made, and you need to be comfortable with the person that's like navigating this conversation with you. And if they're completely off on another planet and don't have the same values or opinions, that's going to be really hard to meld the two together.
Yeah.
So I think the luxury that our patients have here at 3W is that it's not just this quick in and out kind of appointment. You do have the time to really sit down and get to know each other. And that's something that we really value with our patients, is like, now we're able to now we have a good, I want to say a wide range of clinicians that we've brought on with all different personalities, characteristics, and patients can come in and say, that was a really great appointment. I'm not really clicking with her. Could I see this other person?
Yeah.
And you have the ability to spend an hour with our clinicians, which is a luxury.
Totally. Yeah.
A luxury that not a lot of patients get unless they come here. And you really get to know each other in that hour and get to know our team. And that's something that I want to say, like, really hone in, and that's our value system. But if you go anywhere else, you should have the luxury to be like, something didn't sit well with me. I think I'm going to shop around a little bit more.
Yeah.
And balance that with the small roster that you have these days as well, though.
Yeah.
So it's a fine balance.
It is. Yeah. It's a conundrum. I personally don't see anything wrong with shopping around.
Yeah.
I think that is really an important foundation for the patient-doctor relationship, is to just be comfortable. And so I think that is important. I think, you might have to balance it out with a waiting time. So I guess it probably depends on what your issue is, like what your healthcare concern is, what your past medical history is like. Because there are some people that, are relatively healthy. They don't have any chronic illnesses or anything like that needs frequent visits. And so I feel like if you don't have a lot going on, then you probably don't have to be too picky, like just establish care in a sense.
Right.
But if there's someone that has chronic illnesses or chronic illness and needs to be frequently followed, then that might take some investing in the sense of you want to find someone that is willing to take the time to learn about what it is you're dealing with.
Sure.
And so it's like, again, up to the patient of how long are you willing to take to do that.
Yeah.
Hopefully you're lucky and you're able to find someone that you click with on the first try. But I've honestly told my own patients, you're welcome to seek a second opinion, kind of thing. I think that's pretty common.
Yeah.
Actually, when you see a specialist, you're more than welcome to seek a second opinion. Or if you didn't vibe well with the first person that you saw, you can always stay with that same office and just see a different physician or professional within the office.
Yeah.
I don't know that any physician gets hurt about that, honestly, because it comes down to caring for the patient and what's best for the patient. If a certain physician is not, the best option, then that's fine. I don't think that anyone gets personally hurt by that.
Good.
So.
Yeah, I'm glad you said that, because I think there's some folks out there that would be like, how do I tell this person? If it's the same practice, you might run into them when you go to the next appointment and you're just like, well, that was awkward. I don't know if I want to do that again. But it sounds like it happens all the time. And have you ever been in a position where vice versa, where you're just like, me and this patient is not going to click. Ahead of time. Would you, as a clinician, go like, I think you should go see this colleague of mine, because I feel like you guys would be more on the same playing field versus me, because this is the direction I'm going to go.
Yeah. There have been instances where I've called that out. I can see that like what I'm saying doesn't sit well with you. What are your thoughts?
Mhm.
Kind of thing. And maybe they'll say something like, oh, I'm really interested in this. And I'll be like, one of my colleagues actually has a special interest in that. They are so interested in it. And I think I think you would really enjoy working with them and vice versa. So I've made those recommendations before.
Good.
And there are other times where I won't directly say it to a patient. Sometimes they will say unkind things, and I don't take it personally. Sometimes I think it's people's personalities, and they might do it with any physician. But honestly, like, yeah, with anyone. But sometimes, like when that's happened, sometimes I think, is it because I'm younger, because I'm a female, you know, and I'm like, maybe you would do better with someone who's older, more experienced, or the same sex as you, whatever. And I won't always say that directly to a patient, but that's the beauty of having an office with multiple physicians and other providers there, and the whole office staff, is that they can work things around to like schedule with someone else without really making a big deal of it. Because I don't think it has to be a big
I don't think so. No. And like you said, like you as a clinician, like you're an individual too, and you should be able to, lack of a better word, pick and choose, not to be put in a position where you're hitting your head against the wall with this specific patient or being treated poorly because they're just not vibing on a variety of reasons that they're allowed to. And that same goes for you as the person collaborating with this person with their healthcare. So I think it's really wise that and it sounds like you've put that into practice already, that you could be like, this is probably not going to work for us, or I'm feeling a certain way. And you could say, this other person can work better with you. There are certain patients that's just the noise they make. Like, they're just never going to be satisfied with anything or anyone. But at least you can exercise that to say, you know, that's just not, I don't think this is going to work out. And I think that's honoring to the patient as well, to let them know that, no, I'm not going to put up with your bad attitude.
Yeah. I think like a positive way to put it is like acknowledging what people are looking for and just humbly saying like, that's not something that I can offer. Yeah. But pointing them in a direction where they could find the services that they want or need or feel more satisfied in, where I might just not have that expertise. Yeah. But I've been surprised too, where I felt like we were not vibing. Yeah. And then all of a sudden I get a patient survey and it's like, they loved me. Yeah. And I'm like, okay. Like maybe I was just not reading the room thing, or it's like, I felt like it was like an abrasive encounter, but then like they choose to see me again. And I'm like, all right, let's try it again. It's just like another opportunity for me to see how I can change. Yeah. And I think that's like kind of a general principle of medicine, is like you're always seeing how you can do better. And I think that's also what drew me to medicine, is like we're always called to be better. We're always called for excellence. And I think that's just how we should all look at ourselves in general. But medicine has a special place. And it's like you're not bettering yourself for yourself. You're bettering yourself for others. And I think that's just a really humbling and beautiful thing that physicians get to do. It's a privilege. Yeah, it sounds like you're constantly, as clinicians, you're constantly just learning, constantly refining your tool. Like the minute I feel like you've hit this specialty, you move on to this other piece, because the body is this constant puzzle piece and everyone's unique and everyone's and you're just like, oh, I can really go down this rabbit hole until a point where science kind of plateaus itself, but then there's this other piece, because it's all interconnected, right? And so it's fascinating to me. And again, things that I realize about myself in my own personal journey in medicine, of like, this is why I'm not a clinician, guys. This is why I do the admin side of things. And we get to encounter folks like Theresa who are like, I want to constantly learn. And I'm just like, I am reaching almost 40 and I don't want to learn anymore. So I'm so glad for folks like you. To wrap things up, why have you
Why have you joined our team? Why 3W specifically? Because compared to what you were saying with primary care, and I know that you've just been offered a beautiful position in another major hospital system out here that's still kind of unfolding, but why our little clinic out here in Seattle and our narrow scope of practice in women's health?
I think, one, the population that you get to serve. I love that, there's no requirement for insurance, and it's regardless of how much money a person has. It's like, no matter what, you get to have the best care.
Yeah.
And truly, like, you see it physically in how the clinic is set up. Like, I've worked at other pop-up clinics, other clinics that are meant for underserved populations. But this is a whole different ballgame of just how beautiful the clinic is set up. And you truly feel, I think, that you really feel special in that space as a patient. And it's just different than other clinics that I've been to. So I think that bullet point is basically to say, like, I love the mission that you're providing, like, substantial, beautiful, evidence-based medicine to all sorts of women, regardless of where they come from and where they come from, how much they have, kind of thing. It's just open to everyone. I love that. I love that mission. And then two, from a physician's point of view, I love the fact that, like, you're prioritizing the healthcare professionals in a sense in caring for them, because I think a traditional system, the way that clinics are built now, is around 15, 20-minute appointments. That's just how things are nowadays. And that honestly leads to burnout, because, as I had said in the very beginning, I came into medicine, and I came specifically into family medicine because I enjoy the patient-physician relationship. I love that time getting to know someone and just having time with them. But you don't always get to do that, practically speaking.
Yes.
But at 3W, we are given the time to do that.
Yes.
Like you said, it's a luxury to get that full hour.
Yes.
Which I think is amazing. So I think that's something that I'm looking forward to. That, one, I get to serve women across the spectrum, and two, that I get to do it with this big chunk of time, and it's not rushed. And so I'm just excited for that opportunity to really practice medicine in a way that I think a lot of physicians went into practice for, is to just have that time, not think about the chart notes, not think about billing, but to just think about the patient, about the person that's in front of you.
Thank you so much for sticking with this long journey that you've been on. We are so incredibly proud and blessed to have you on our team. And I know that as people, we took your headshot this weekend.
Yes.
We took your headshot. We're going to put you everywhere and let people know that you're on our schedule and you're able to provide this amazing care to the people that walk through our door. They will benefit so much from your care. 3W has become this, we've carved out this, like, very specific place in the city, in this very large, bustling city. We've carved out this very niche specialty of women's care. And now with someone like Dr. Santos on our team, we've continued to just elevate our reach. So thank you for finishing the fight, finishing the gauntlet, and landing where you're landing. And I'm personally so excited to see where you go with your future. And hopefully we continue to grow ourselves. This is just the beginning of something much bigger. So thank you for what you do and hanging in there.
I'm excited. Thanks for having me.
Yeah. All right, guys. Like you heard, if you've been looking for a primary care, Dr. Santos is on the market. And she's ready to rock and roll and see you as her patients. And if you want to get a taste of her before she lands in this major hospital, which I won't mention yet, but that is to come to 3W and experience Dr. Santos and experience her care here. You can talk with her for an hour. She's able to do more once she lands in this other position, but this is a really rare gift that we could provide for the community to have someone like her and her expertise and her passion for healthcare in our community. So thank you, Dr. Santos, for joining me today. And you'll be hearing more from Dr. Santos. Trust me.
For sure.
Yeah. Thank you.
Thank you.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.